There are big questions hanging over CVS Caremark's prescription refill practice. Medicare is investigating reports that the second largest drugstore chain is refilling prescriptions and submitting insurance claims without patients' approval. That is according to the Los Angeles Times sources. Shares of CVS today down on the news, but the second largest drugstore tells Fox Business directly that it has not been contacted by federal investigators. Let's bring in Dr. Sreedhar Potarazu, CEO of Vital Spring Technologies. Dr. P, thank you so much for joining us. What do you make of this case? You know, there's a precedent with CVS because they did, reach a settlement for selling drugs at the wrong prices to seniors and disabled people. So there's a history with CVS here.
You know, there is a history with CVS, just as you said, on the Medicaid side. And as big as CVS is, there's always this concern that they have the ability to go out and be able to overcharge without much oversight. So this is really worrisome if it's true for Medicare beneficiaries who are getting charged or having prescriptions sort of doled out and charged for by CVS to Medicare. But it really raises an even bigger question about what has driven these companies to actually want to go out and do that. The Obama administration has talked a lot about wanting to get fraud out of the system as a means for Obamacare. So you have to wonder what sort of the motivation is for the companies to do this.
Dr. Pete, when we're looking at specifically what happened in this situation, they're talking about CVS going ahead and refilling a prescription that you've already had filled there before you asked for it and charging it to the insurance company or to Medicare right at that moment. Is that an unusual practice? I mean, they say it's against company policy, but is that something that you think happens a lot?
You know, it is an unusual practice. And I think you raise an important point in terms of the checks and balances that are not fully in place. And there are a lot of areas, just like the one that you described, where as they're trying to understand about this whole issue of overcharges, they've got the FBI and HHS trying to go in and do these sample audits for the prescriptions that are being filled. That isn't going to cut it. You can't go in and try to sample and hope that you catch something. The reality is that they've got to get a lot more sophisticated if they're in fact going to find out where these overcharges come from.
You raised an interesting point when you asked the question of you have to wonder about the motivation. Do you think these pharmacy benefits managers, these pharmacies themselves, are fearing that the dollars, the revenue streams are going to dry up under Obamacare?
I really do. And if you look at a couple of things that have happened since Obamacare has been implemented, insurance companies and the pharmacy benefits managers are clearly in a bind to take on more people, to cover more people under their programs. And so they're looking for every possible avenue to stay afloat. The other thing that's happened, even more concerning, is that the idea is that we were trying to drive more competition to bring prices down. But you see the insurance companies that are starting to consolidate. There are only really 3 major pharmacy benefits managers. So when you look at the amount of market share they have, there isn't really much competition that's preventing them from doing whatever they want. And a lot of that is really on the rebound of what happened with Obamacare. And sort of, it was an interesting discussion last night at the debate about the impact to Medicare. But here's a great example of if the idea of taking $760 billion out of Medicare by looking at fraud and abuse, well, if this is the approach, that's pretty scary.
And I just want to say before we go, because we do have a statement from the CVS spokesman, Mike DeAngelis, who says our adherence to the programs require that patients' consent be obtained before a prescription is refilled. And at this time, we haven't been contacted regarding the investigation. So they're pretty much denying that this is going on. We just want to make sure we get that in there because we did contact them and ask them for their side of the story.
Right.
Okay. Dr. Sreedhar Potarazu, thank you very much.
Dr. P, we call Dr. P. It's even easier.
Thanks. Less of a mouthful.
There you go.
A great guest for sure.